Good afternoon. I'm Myra Pipes, the on-site benefits administrator for Dallas ISD. And with me is Royce Thigpen. He is our retirement specialist for DISD. Today we're going to be talking about eligibility, TRS Active Care Medical Plan highlights, benefits options overview, how to enroll, making changes, work-life services, and the retirement program review. The benefits plan year starts over again September 1st, and it goes till August 31. You have 31 days from your start date to make your elections, unless you were a substitute and you're starting to work on a full-time position. You are covered under the open enrollment benefit period, and that terminates August 22nd. If you do not enroll during your new hire eligibility period, your next opportunity to enroll will be during the next annual benefits enrollment, which is in July and August, effective September 2018, or if you experience a special event. And you have to call within 31 days of that special event to make the changes. To elect benefits, begin on your first day of to begin the first day of your employment. Once you enroll, you can say, hey, I want my benefits to start August 1st. You need to call Benefits Outlook, and they will change the start date. So this is the magic thing. Dallas ISD at your service, which is at disd@yourservice.org. That's where you're going to find all your enrollment information. And it can be accessed from any computer. The registration required is username, which is the employee ID, and your password. Enrollment eligibility changes, plan options, summaries, plan documents, rates, and beneficiary designation will be in that website. You can also call in at 866-840-3473. They're open 7 to 7, Monday through Friday, and 7 to 4 p.m. on Saturdays, only during the open enrollment period, which is now until August 22nd. And Spanish representatives are available. I'm going to talk a little bit about the plans. I'm not going to go into in-depth. I'm just going to do summaries. TRS Active Care Medical is administered by Aetna, and all our medical plans are chosen by TRS. We have 2 PPOs, which is Active Care 1, high deductible, and Active Care 2. We have an ACO, which is Active Care Select, and it has in-network coverage only. And then we have an HMO, which is Scott and White. All plans include preventive care visits covered at 100% when services are rendered by an in-network provider. With Active Care Select and Scott White, there is no out-of-network provisions unless it's a true emergency. There is a pharmacy plan included on medical options, and it's administered by Caremark or Scott White, depending which option you choose. And there's some over the, go to the pharmacy, and they also have mail order provisions. Preventive care, covered services that are covered at 100%, and the deductible is waived. There's no copay required. Routine annual physicals, immunizations, child care, cancer screenings, gender, age specific. So it doesn't matter which plan you choose, all of those are covered at 100% as long as you use the network. Remember, always use the network. Medical plan comparison. I'm just going to do a quick snapshot. Uh, the, what you pay depends on deductible and the network. For Active Care Select, the deductible is $2,500. Maximum out of pocket is $6,360. And then after you meet your deductible, everything is 80/20 as long as you go in the network. If you go outside the network, it's 60/40, and you have a different deductible for out-of-network. Office visit copays are paid out at 80% after you reach your deductible. So are prescriptions. So on this plan, there is not a true prescription coverage till after you reach your deductible, and then prescriptions are paid at 80/20. Active Care Select, you must use the Active Care Select network. The deductible is $1,200. Maximum out of pocket is $6,350. And coinsurance network is 80/20. Office visits copay are $30 for primary, $60 for specialist. With Active Care 2, it's the most flexible plan, and it's a PPO. The deductible is $1,000, maximum out of pocket is $6,000, and then 80/20. $30 for primary care visits, $60 for specialist. And then we have a true HMO, which is Scott White. The maximum deductible rather, it's $800. Maximum out of pocket is $5,000. Coinsurance network is 80/20, $20 for primary care, $50 for specialists. With this, you have a lot of flexibility because you can self-refer yourself to a specialist that is in the network. Then we have Active Care Select, network only, and it covers the following counties: Dallas, Tarrant County, Collin, Denton, Ellis, Parker, and Rockwell counties. Does not cover any counties not listed there. And it uses the Aetna's Whole Health Network. And some of them are Baylor Scott & White Quality Alliance. And remember, no coverage outside the network unless it's a true emergency. The district contribution, this year, the Dallas ISD is increasing their contribution to $317. So TRS Active Care 1 is $351. So with the district contribution, it's going to be $34 per month. So it plays 90% of the plan. TRS Select is $197 employee monthly contribution. TRS 2 is $397, and Baylor Scott White is $244.04 a month. If you decide not to go with our insurance coverage offered by the ISD, you must complete the declination certification form found on the website at theisd@yourservice.org, and you return the form to address shown on the form. Failure to complete the declination certification may result in denial of future coverage. Dental benefits, we have a total of 4 different dental plans. One is a discounted program only through Humana. And then we have a DHMO, no deductible, pay code, copay at time of service, and you have to select a primary care dentist from the network. EPO, you pay a deductible before the plan starts. Then there's a copay at time of service, no primary care dentist required, and you can use out-of-network providers. PPO, You pay a deductible before the plan pays its share of expenses in out-of-network providers, and you are responsible for costs above usual, customary, and reasonable guidelines. The PPO this year also added adult orthodontia and implants. And like I said, Humana Dental is just a discount program. Vision. We have United Healthcare, Vision as our provider. There's a premium and a basic. Both plans cover eye exams at 100% after a $10 copay. Plan benefits differ in copay for frame lenses and contact lenses. To find out who your provider is, there's a phone number that provides the list of providers. You must go to a provider in order to receive the benefits. So now to enroll, you go to disdatyourservice.org. And your username is going to be your employee ID number, month, date, last four of your social. A lot of you have not been able to log in because your official start date was yesterday or today. The file transfer occurs on Fridays, so you should be able to enroll by next Wednesday. And keep in mind, if you're a new employee to Dallas ISD, you have 31 days from your date of hire to enroll. So right here, again, you register at DISD at your service, your employee ID, month, date, last four of your social. You will go to the Common Forms and Plan Info link. There you will see all the information on all the different plans that we offer. There is also a new hire resource center. There's several videos available. And right there you also declare special events and select new hire event. Benefits Outlook, 866-840-3473. They're available weekdays 7 to 7 and Saturdays from 7 to 4 Central Time except holidays. But only until August 22nd will they be available. The week of August 22nd will they be available on Saturdays. I do not recommend using. Right now, we're having open enrollment, and when you call, there might be a long hold time, but they're doing something a little bit different this year, which is fantastic. What they're doing is they're going to ask you for your number, and then they're going to give you a call back that same day. So that is something they've added, and I think that is wonderful. They avoid a long waiting time. So when you go in, you're going to go to select Common Forms and Plan Info. As you can see, it says Enroll Now. And you're going to have the option to say New Hire, or you go to Open Enrollment. So special enrollment events, it's when you adopt somebody or you have a newborn. They're going to be covered the first 31 days of birth. All other special enrollments, events coverage begin on the first day of the month following the date of the event date. Gain of other coverage effective first of the month following the date of notification. So if you were to call on the 15th of the month and say, hey, I have other coverage, that's not going to be effective until the first of the following month. Again, special enrollment begin is at disdatyourservice.org, and you just click on Declare Special Enrollment. So the steps to enroll, you just access disdatyourservice.org, review your plan options, provisions, and rates, click on Enroll Now, make your add your dependents, designate your beneficiary. I cannot stress how crucial that is. Part of your benefits for all employees It's a $10,000 life insurance policy. So we want you to designate your beneficiary. And then you're going to make your elections, and then when you have completed, click Finish. If you do not click Finish, nothing will be saved. Print or save a copy of your confirmation for actively at work, effective date of coverage, contact Benefits Outlook. So if you started yesterday or today, you can call Benefits Outlook and say, hey, I want my coverage to start August 1st. So now I'm going to give it up to Royce Thickpen.
Good afternoon. Who's ready for retirement? What a crazy question to ask at new employee orientation. You know, I found out it gets here a lot quicker than you think. Normally, I have a 45-minute retirement presentation to do. However, with your permission, I can do it in 12 and a half minutes. Okay, 12 and a half minutes it is. I'm here to talk about 3 retirement plans. 1 is mandatory, 2 are voluntary. The mandatory plan is the Teachers Retirement System of Texas. If you've worked in public education in Texas before, you know that it's mandatory, and you also know that it's contributory. If you've never worked in public education in Texas, it's mandatory and contributory. All right? How about that? You see on the slide that the contribution is 7.7% of your pay. So what does that mean? It means that every time that payroll pays you, they're going to deduct 7.7% out of your paycheck. They're going to send it to TRS in Austin. They're going to put it in your account with your name on it. The significance of that is this. If you ever become disenchanted with employment and public education, let that soak in a minute. In other words, you quit and you leave, you can always withdraw your money plus interest from TRS. If you work long enough to actually retire, we're going to talk about how that works in just a second. Excuse me. Currently, the state of Texas contributes 6.8% of your pay to the retirement fund. The only way you can get that 6.8% is if you work long enough to actually retire. Here at Dallas ISD, we do not participate in Social Security retirement. So there will not be a Social Security deduction for Social Security retirement out of your salary check. However, there will be a tiny deduction for Medicare. There'll also be another tiny, what I call tiny, for something called TRS Care. Unfortunately, that's a mandatory contribution. We as full-time employees get to help pre-fund the retiree medical plan. I can tell you're excited about that one. Okay, the retirement plan is what's called a defined benefit plan under the Internal Revenue Code. Simply put, what that means is your retirement benefit is arrived at through a formula. For most of you in the room, it's going to be the average of your high 5 years of salary over your working career times the number of years you work and pay into TRS times 2.3%. I know we have some smart math teachers and science teachers in here. So how that works is this. You work 10 years, 10 times 2.3 is what? 23%? 23% of your average salary, that's your retirement benefit. If that's not enough, work 20 years. 20 times 2.3 is 46%. 46%. You see how that works? From time to time, we have employees coming in the retirement office, and they say, I'd like to retire to 100% of my salary. Wouldn't we all? Do you know under the TRS plan, you can actually do that? How many years you need to work to accomplish that? Try 43. We attended a retirement get-together the other day, last week at the admin building. The lady had been working for DISD for 44 years. So if you're one of those that like to work at least 43 or 44 years, we do have a sign-up sheet down here. You can sign up today if you'd like. Enough of that. There is a death benefit under the TRS plan that I'd like to mention to you. It's the lesser of $80,000 or 2 times your annual salary. Now, what you might want to mention to your named beneficiary, it's a taxable event because it's a distribution from the retirement plan itself. The contribution that you make, the 7.7% I talked about, that is a pre-tax contribution. So that's the defined benefit mandatory plan. We will notify TRS that you now work for Dallas ISD, and like I mentioned, your first paycheck, there'll be a deduction for 7.7, and then subsequent paychecks. Excuse me. We do have 2 voluntary plans here at Dallas ISD. One is called a 403B tax sheltered annuity plan, and one's called a 457 smart plan. If you're not familiar with these 2 types of plans, they're very much like a 401k. In other words, the primary advantage is the contributions you make to the 2 plans are pre-tax. So you don't have to pay current income tax when you make contributions. For the calendar year 2017, the general limit is $18,000. If you happen to be age 50 or older, you may contribute an additional $6,000. How does the 403B and the 457 work? Very different than the TRS plan. In other words, the money you contribute and what it earns or loses, that's your benefit. So the moral to that story is invest wisely. You see why I'm still working? Okay, that's another story. Under the 403B plan, we have some 50 investment companies for you to pick from. Some of us like a lot of choices, don't we? Some of us, like myself, we have trouble making decisions occasionally. If you're one of those like myself, you have trouble making decisions, you don't know which company to pick, or which of the hundreds of investment options to pick, you're welcome to use my method. You put that list on the wall and you throw that dart. Okay? We do have a third-party administrator. A number of you picked up a sheet in the foyer a while ago. TCG Administrators does all the record keeping. You contact them. You can change your deduction, start, stop, change your deduction any month you elect to do so. You're not restricted by the 31 days. Like I mentioned, we have a second plan, a 457B Smart Plan. Yes, you may contribute $18,000 to the 403B and an additional $18,000 to the Smart Plan if you like to do so. However, the Smart Plan, it's a lot easier to get into because there's one investment company and they have some 23 investment products for you to pick from. You just contact Empower Retirement Services, tell them how much you want deducted, they notify us, we download it into the payroll system and we make that deduction until you tell us to stop. Now, if you've worked in public education for a number of years and you retired with TRS and you got bored and now you're back working, we will not deduct TRS out of your salary check because once you retire with TRS, you've retired, and so you no longer accrue an additional benefit. However, you may participate in the 457 and or the 403B plan. This is the plan we don't need to go into because all of you are full-time. This is for our substitutes and our part-time employees. Which brings us to the last slide. How about that? The disclaimer. Simply put, what this means is if Myra or I've said something that's not true, just ignore it, okay? Welcome to Dallas ISD.